if it lets me.
Got it.
There we go.
Excellent. So hopefully I won't disappoint today. So I did a talk a few months ago on autism in girls and kind of how we assess and how we understand girls' presentations to be different to boys. And I think the feedback from that was, yeah, but what do we do? How can we help them? So I'm going to try and talk a little bit about that today. So I will just quickly start for people that missed the other one and a recap on autism in girls, how it looks different. And then I was thinking about what kind of things people might be wanting. So thinking about what issues might be present in girls and how to support them. So thinking about their bodies and maybe puberty, thinking about friendships and relationships, and also thinking about kind of healthy minds and emotional well-being. I will talk a bit about mental health in girls with autism as well, and when you might need additional help. So that's kind of threaded through the themes. So if we just start a little bit thinking about autism characteristics.
Like the therapy, they still think she probably needs medication to even
I think somebody's
her
not
anxiety down so she can access the therapy.
There we go. Okay, so we're just going to talk a little bit about the difference between boys and girls. So we know in boys, the presentation can be a bit more obvious, a bit more noticeable. So they might be more repetitive, more limited in their play. Their social communication issues may look different. So with boys, they may prefer to just not get involved, or happy to be on their own doing their own things, have lots of interests that are quite often less usual for a boy of the typical age. So things like looking at transportation timetables, watching schedules, knowing all the stars or something like that. Whereas in girls, we might have interests that are very typical of a girl of that age. So TikTok or Snapchat, or they're looking at, I don't know, the things that other girls are interested in. So, but they just might take it to a more obsessive place. They generally are less repetitive and often can manage play. So they might be able to do imaginative play, but if you watch it every day, it can be a bit repetitive in nature, but they'll do, play with dollies and things like that, whereas boys won't, more likely to line things up. More able to manage some of the social demands early on. So often girls at primary school age, early primary school age, will fit in fine. Others may not notice that they have autism or difficulties with social interaction. As they get older and the social interaction becomes more challenging, that's when they might find it more difficult to manage. And actually, that's what we see in clinical practice a lot, the sort of more end of primary school, beginning of secondary school, sort of saying, well, I'm different. I had a girl yesterday tell me that she would, it's not a difficulty. My communication is not a difficulty because I know when I should stop talking about my interests, because I know nobody finds history interesting. So she's got that insight, but she would rather talk about history the whole time. So it's slightly different presentation. And I think the main difference between girls and boys is because they have this awareness and try and modify their behavior. We talk about masking sometimes. And so they may mask some of their difficulties with autism in order to fit in and manage. But then that can lead to lots of overwhelming feelings, anxiety, more likely to feel depressed because they realize they're different. So I guess that's what we're really talking about a bit today. So I'm going to start by talking about healthy bodies. And one of the things I was going to say is, you see in the corner, I've got something called Mind the Gap. Before I came here, I worked for a different trust in London, and we devised an intervention for children, young people, mainly teenagers, girls and boys with autism. And it was because in CAMS, we got loads of referrals for autism and anxiety. But when we tried to sort of work with typical interventions like CBT, actually the young people were saying, well, I don't want to go to school. That's not my goal. I want school to change so I can fit in. Or I don't want to, I'm anxious about friendships because I can't make them. I don't know how to. So instead we ran a group called Mind the Gap, which was about how really they don't fit into mental health services and they don't really fit into sort of not having some extra support. So we had this group that helped with that. And it
Hello, I'm not sure if it's my end or your end that's frozen.
Frozen for us too.
Okay, good. All right, I was panicking that it was my end. It must be something Laura's end. Just
hello, I think I just dropped out. I'm
you
sorry.
you did. That's all right. I was just having minor panic that I had dropped out and
No. So I'm sorry if
disappeared.
that happens again. It's
No,
sometimes
it's fine. That's all right. Not a problem.
internet.
Thank you.
So is this is where I was, wasn't
Yeah,
it?
yeah, you're back.
Great. So we need to look after our bodies basically to be able to look after our minds. So having good sleep, having good diet, managing, having adjustments in school to manage that environment. And without those things that, a young person's going to feel more stressed and more overwhelmed. So one of the, I suppose, areas that comes up a lot with girls with autism is eating. So we have to eat healthily, and that's really important for young people with autism as well. So eating a regular, balanced, healthy diet. And we know that young people with autism are more likely to be fussy eaters, picky eaters. They may also struggle with, planning of what the meal is. So you might, I don't know, make spaghetti that night and they go, I don't want spaghetti. Or I'm not eating that tonight because I'm feeling fussy. And I can't eat the texture of that because I've had an overwhelming day and it's just not the right texture tonight. So there might be strategies that you'd use as parents to sort of support eating healthily. So maybe providing 2 choices. So maybe setting in a menu in advance. So saying in the morning, should we have this or this for tea? A question like, what would you like for tea, is probably a little bit overwhelming. So those 2 choices allows you to have a bit of control, but them to feel in control. You might also be considering the environment that they're eating in. So is it too noisy? Is it too busy? I think one thing that I hear all the time is meal times are so stressful. She never eats, she's crying, she can't do it. And I think she's got an eating problem. And then actually what we work out is that if we take the other demands away, the eating's fine. So if you think sitting in a busy household at a table, having conversation, talking about stressful things like school, maybe having your baby brother throwing food everywhere, or screaming, those things can be just so overwhelming. And food is already
go away,
and eating is already a stressful, overwhelming sensory experience. So we then need to make allowances for these sensory issues. So by putting in place some things like having your meal in a separate room, or having a separate table. I've had people that have a little table just a little bit further away, so they're still part of the dinner time, but they've got a bit more space and a bit more control of what's happening around them. Of course, we do see eating problems in children and young people with autism, particularly girls. So we might see 2 things that we might come across in CAMS are things like ARFID. So if people have heard of that, or if you haven't, it's a new-ish diagnosis, avoidant restricted food intake disorder. And this is where a young person may eat such a restricted diet. So they want to eat, they're not trying to lose weight, but their diet is so restricted, often because they can't cope with certain textures, tastes, smells. So it often has quite a large sensory element to it. And in terms of what you do with that, it's really difficult. We do have a working group at the moment in the city around who helps these children, because they kind of fall between the gaps. So there's not really enough evidence base for sort of psychological intervention, because it can take years. It can be really stuck. We might use we might advise people of a kind of graded approach. So, introducing small amounts of other food that are very similar to what they already eat. It can take years to change that. And I think the main thing is to think about going to the GP if you're concerned about nutrition, weight loss, and they would probably refer you in certain circumstances to a dietitian or a pediatrician to think about nutritional supplements, or to help support with the dietary choices that they can eat. Often the response, which I know is hugely anxiety provoking for parents, is that actually we've done some blood tests, they're nutritionally fine, or so therefore we can't do anything, or they're having their supplements, so that's all we can do. And I know that's really difficult for families, and I think getting the support from groups like Reminds is a really good place to start, because I know lots of people struggle with it, but we know that psychological intervention just doesn't really make shifts that we'd want it to.
Laura,
Yeah.
can I just say we've got
Yeah.
a talk coming up at the end of January from the dietitians at the hospital about ARFID.
Brilliant.
And then in February, we've got one from Joe Barker about disordered eating. So we're hopefully covering those things.
Lovely. And I was going to say, I think Joe's done one or doing one. And I think the main thing, I know this is really hard to say, is just try not to worry. If they're getting their nutritional intake from either a supplement or the GP's done tests and says, well, they're all fine. The main thing about it is to stop pressurizing around food. So I think as a parent, of course you're going to be anxious about it. Of course you're going to want your child to eat. But as soon as you start sitting down and go on, try a bit more, go on, just have another bite. Oh, please, 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 you've got to eat. When you're doing that, that child's then feeling more anxious about it and is likely to then restrict more. So it's really just saying, here's your food, have a go, not to worry. And I think the other thing that comes up so much is putting time limits on it where you can. So if they're getting their nutritional intake again, you want to take the food away after, say, half an hour. I often hear with ARFID kids that it's taking 2-3 hours to get a plate of food in them, and then there's another meal already. And so the whole day becomes this pressurized experience of trying to get them to eat. And that's just not healthy for anybody, for you, for them. So it's really just giving them that option to eat, but then also giving them time to do other things. The other side of eating problems that we might see are eating disorders. So things like anorexia and bulimia, you might have heard. Now, I think because of the autism profile, we do see more young people with autism than without, particularly in girls. And I think it's about the rigidity and the inflexible thinking. So when a girl with autism who perhaps has been bullied, is struggling to fit in at schools, watches some TikTok video and thinks I want to look like that, they're more predisposed to being anxious, they're more predisposed to being rigid and sticking to rules. They make rules for themselves about wanting to reduce their calories to 400 calories a day, and they'll stick with it. So you do see eating disorders more in girls with autism than without. And the things that you want to be worried about are kind of changes in weight, noticing that they're restricting their eating, hearing them talking about counting calories or watching calories, and changes in kind of behaviours around food. And I think in the first instance, go to the GP. In terms of what we do in CAMS, we will always ask the GP to see them first to get bloods, weight, height, so that we have that information, because it's really important in terms of how we treat a young person depending on how physically impaired they are. So we might look at a young person and say, oh, they're very slight, they're very skinny, but actually that might be within their what they normally are. So we need some information from GPs to take forward referrals. But definitely, any concerns about severe weight loss or restricted eating, go to the GP and you'll get a referral to CAMS and seen very, very quickly. So that's my advice around that. So also thinking about things that are really important to keep our bodies healthy is exercise and activity engagement. So I often hear in CAMS, the most severe end is that, my child is doing nothing. They're not going to school, they're not getting out of bed, and they're not playing games anymore, we're not talking to people. And actually we need a level of exercise, a level of activation of our brains, whether it's doing some puzzles, whether it's playing a computer game, whether it's talking to somebody, something that feels like they're getting a sense of achievement from it, or a sense of enjoyment, or feeling part of something. We need all those to, to feel okay. And I think what we know is lots of young people will maybe become so stressed and overwhelmed in, say, school, they reduce going to school, that reduces their anxiety, but then because they're not doing anything, they then end up feeling more depressed. We know that when we exercise, when we do positive things, we release chemicals such as endorphins, and that improves our mood. So always when a young person or a girl with autism is explaining that they just don't feel like they want to do anything, they don't want to go anywhere, they'd rather be on their own, but they're also struggling with mood, the first thing is just to find some activities that they will do. So that, it could be something quite solitary, doing a puzzle. It could be going for a walk with a dog or a parent. It's just finding those things that they will do, and then those things that they can get motivation for will improve their mood. Sleep is another big one, and I'm sure you've had actual talks on sleep, so I'm not going to talk a huge amount about them, but we know there's a close link between sleep and mental health. So if you have poor mental health, you get stressed, you get depressed, that can affect your sleep. But also if you have poor sleep, that can make you tired, emotional, unable to do things. So it's just a vicious cycle. So we might start by feeling worried, we might lack sleep, when we feel tired, then we have difficulties coping with our day, we might have low self-esteem, low self-confidence because we can't really do the things we should be doing, and then we feel more worried. So sleep is an area of concern, particularly in young people with autism, because we know that they don't seem to need as much sleep and they find it much harder to switch off. So I've added here some sleep hygiene. So I know some people might be thinking, well, I know that young person over there, she has melatonin and that's really helpful. Sometimes that can work, but what we know is melatonin, which is a sleep medication that's licensed in children with autism, it won't work unless you have a good sleep routine as well, because if you take it and you're not used to going to bed at a certain time, or you don't have to go to bed, or you haven't had that sort of switch off time, it will just make you a bit drowsy and then you'll just fight through it and it won't work. So it's important that you start with getting a routine. And so this might be things like changing diet, so not having Coke just before bed, or lots of drinks, or lots of heavy meals. It might be having some exercise in the day to regulate your tiredness and make you tired. It might be not playing computer games just before bed, but having a warm bath, reading a book. It's those kind of strategies. So I've put in some, and I can send these slides out to Jill afterwards, put in some really good places to go for sleep hygiene, because that's probably the good starting point. Puberty and periods. I kind of struggled when Jill said, oh, I think people want to know what to do. And I was like, oh, I don't know. But I had to think about it and then thought about what are the difficulties for young people with autism, particularly girls. So all children go through puberty, it's inevitable. And it's, it's difficult for every young person. And so I think one of the things is preparing them for that. So I think lots of people will think, oh, well, they've got autism, they're socially not that as aware as their peers, they're very immature, I'm not going to talk to them about that yet. And then the next thing it happens, and that's a real shock for them. So I think what happens sometimes is, schools might talk about it, but there might be a lack of detail, or friends are mentioning periods, but they don't actually know what that is. So it's about being really clear about what it is, what's going to happen, what we're going to do about it with your young person. So not avoiding, which feels much easier sometimes, but having those talks. And I've always found that social stories are really good to help with kind of difficult to explain situations, because you can get a step-by-step approach. And I've got some on the next slide to sort of show you. In fact, I can go forward and come back. So, for example, we can't see them brilliantly because I just got them off Google and then stuck them in, but you might have something about the importance of taking care of myself. So as an 8-year-old, if you're running around every day, you probably don't need a shower because you're probably not going to smell and sweat in the same way as maybe a 13-year-old will. So if you've got, I don't know, a 13-year-old who likes going out and doing lots of running and exercise and jumping around in trees and things like that, the importance of now learning to wash every day, the importance of cleaning your teeth, getting ready, and why we do it. So I think naturally girls will pick up that it's bad to smell or that I want to look nice. Girls with autism may not be so aware of that. So washing your hair and on a regular basis might be something another girl wants to do, but a girl with autism might be like, well, I don't like having my hair washed, it feels horrible, so I'm just going to leave it as it is. So having an understanding of why we do that so that we look nice and so we can feel cleaner, feel healthier, is really important. You can get loads of social stories online. So we've got one here about wearing a bra, why you suddenly have to wear a bra. And then there was another one about growing up and how to use sanitary towels and things like that, and how to, get rid of them and why we use them and things. So I'll go back to the one I was doing. So I think when you're explaining it, it's about saying the facts, trying not to be confusing. So, when people talk about sex education, they talk about the birds and the bees. I think that's going to be really difficult for a young girl with autism to understand what you're talking about. So just be quite factual about it. You might find that your child will not pick up on social cues from peers about what appropriate and inappropriate behavior is. So you might have to sort of help them. So some things that were maybe appropriate when you were younger, like, I don't know, holding boys' hands and things, it becomes a different meaning when you're a teenage girl, and sort of just explaining things like that. Establishing rules about hygiene, around hygiene is really important. And I think the other thing is sort of introducing the concept of public and private spaces. So you might have a girl that, as a little child was playing with herself and masturbating a bit, and actually that's okay as a teenager, and you might want to do that, but actually there's special places you do it. So you do it in your bedroom when nobody else is around, or you do it at a certain time, and it's not something you do in front of people. So it's having those conversations. And then we have to consider the sensory difficulties that these young women are coping with, because there's different sensations, there's different smells, there's pain, there's having to wear something different, can be really challenging for them, and how they manage that. And I think it's really important here as well to mention gender identities. We see a huge amount of young people where they are born female but actually have autism and identify as male, and the gender identity issues that can come when those young people then get periods and start growing boobs, and what that's like for their experience when they feel that they're in the wrong body. So there's lots of things we have to think about there. And I guess what I'm thinking is, if you've got a young person that's really struggling with their gender, really struggling with puberty around that, and maybe also then restricting eating and things, it might be something for CAMS.
Laura, sorry,
yeah.
can I jump in again? We are linking with Breakout Youth this
brilliant.
year, and we're going to be running sort of workshops, talks, advice clinics all around LGBTQ plus I've said it in the wrong order, but all around that. So we've got lots of help and advice coming for that as well. I know I've had a lot of people, and we get posted on the Facebook group an awful lot about coping with periods, and is there any advice sort of more specifically about helping them get used to wearing a pad or using a tampon, and how we can help them manage that, because that's such a triggering area for a lot of our children.
I've put on here, the Sheffield NHS website has some really nice resources on it, some nice things to do, so a bit more detailed. I took some stuff from there,
Brilliant.
but detailed, so that's a really good thing. The other thing I always talk about when I talk about autism, I talk about compensatory strategies. So basically, we have something that's difficult, how can we make it easier? So these days there's these things called period pants, which feel like normal pants. So it might be that a young person doesn't want to wear a tampon or a sanitary towel, but will manage a period pant, which feels just like a slightly bigger pair of normal pants. So it's trying to compensate for the things we find difficult. So that's something I would definitely try these days. But otherwise, it is really hard. It's really hard because they do need to get used to it, or used to something. And
Yeah.
I think, yeah.
We get a lot of, somebody's put in the chat actually that they use period pants, and you know, I think a lot of people do. And it is, I think it's just challenging whether they've got autism or not at that time, and it just takes some time. But thank you for those resources.
And I think that's the really important thing. Being a teenage girl when that first happens is really hard anyway. But being a teenage girl with autism makes it a bit more harder. And I think, you know, you are going to experience mood swings, grumpiness, refusal, crying, tearfulness, you know, that's a normal part of adolescence and being a female adolescent. But I you know, what I'm here to do is highlight why it's more difficult for a young person with autism and what you can try and do.
No, absolutely. Thank you. And some people have put some nice things in the chat that they've tried and that works for their young people. So that's
brilliant. And I was going to say, you guys on the chat are probably more experienced with this than me. And so, you know, it's about, I think a lot of the time it's about trial and error and then sharing ideas together, which is why I always recommend people come to Reminds, because you're probably full of ideas.
There's lots of people with lots of great ideas. Thank you, Laura.
That's all right. So I'm going to talk a little bit about friendships and relationships. I'm really realizing I've already done half an hour. So I suppose one of the things that comes up when we've been doing a group with young people is like, what we take for granted is that we have different relationships with people. So we, you know, I have friends, I might have romantic partners, I might have family that I know really well, but then I also have people I work with that are colleagues, sort of friends, but also colleagues. You have professionals you go and see. So I might see a GP at work, but I also might see a GP for my personal things. So it's whoever you're working with, chatting to, spending time with, we modify our communication to fit that relationship. And I think everybody just kind of takes that for granted. So you'll get the odd thing where you, I don't know, in a work setting where somebody says something inappropriate and you think, oh, I might have said that to one of my friends, but I wouldn't say that to somebody I've just met in a work meeting. And you think that's a bit weird. But a young person with autism is always trying to navigate these difficult relationships and how they should respond. So you often hear teachers saying, well, they're far too familiar with me, or they're not treated, you know, they need to respect teachers. Teachers are, whereas they might not see them as teachers. They might have, you know, had a nice conversation with them once and then thought, oh, they're my friend, so I can ask them about their weekend and I can talk to them about their dogs and their family, and actually they might then be thinking, oh, actually I'm your teacher, I don't want you to ask me all these questions. So I think the important thing is to think that girls with autism have to navigate, how do I respond to all these people? And actually they're pretty good at it. They're pretty good at watching other people do it, masking and then copying, but that's really stressful. So I think that's the sort of point I'm getting across. I think when we're thinking about girls with autism, we need to be aware and thinking of what's the helpful relationship and what's an unhelpful relationship, because they might not get it. So it's important that they have support from people around them. So whether that's teachers, whether that's parents, I think it's really useful if you've got like a friend, or they've got an older sibling, or somebody that they feel they can share things with that they might not share with their mum, just to suss out what's going on, because of course I've got a bit on internet safety as well coming up, but we don't know who our young people are talking to sometimes. How do we know someone is our friend is something that they may not know? So asking those kind of questions is really important, because if they've met somebody online that's being friendly, how do we know that they're also 14? How do we know that they are a 14-year-old girl that we've made friends with, and now they want to meet you at nighttime down the road? You're like, I'm not sure this is safe. And getting them to be able to recognize that actually this is something I shouldn't do without talking to an adult first. We know girls with autism are more vulnerable to exploitation and abuse, and I think that's because of their sort of naivety around understanding relationships and friendships. So social media and internet, we know this is a massive area in recent years about what people are accessing, what they're doing. It has a massive impact on mental health and mental well-being. And I guess the question for you to reflect about afterwards is, do you know what your young person's doing? Because we need to somehow have some control over it, because they're vulnerable. If they can access everything, that's probably quite dangerous. They're wanting to make friends, so they might be on chat sites making friends with who knows who. So we have to have some kind of, there's lots of ways you can, and don't ask me how to do it, but there's lots of ways to block certain sites and have it go off at night time so they can't access anything at night. Or you can just have a rule that at 8 o'clock the phone is locked away with mummy, so you can't have it. But it's thinking about what are they doing, and it used to be that games was really safe, but now you've got chat games that can chat to anybody. Who are they communicating in? What information are they giving out? So you might want to have a safe conversation about internet safety. So you can say your first name, but you don't want to say your second name. You don't want to tell them, you can tell them the city you live in, but you can't tell them your address. So it's just having that kind of safety awareness, because if you've got a young person and there's a potentially, I don't know, adult male asking, where do you live? And they're giving, my postcode is, they're putting themselves in a lot of risk. So top tips, make sure online friends are people that that either you know them in real life, or you're playing with them on a game and it's about the game and you've got no other ways of communicating with them. Never arrange to meet anybody that you don't know. This is advice for your children, by the way. Treat a friend the same as you would with somebody online. Think before you post. So, I think lots of young people might tell a joke to somebody and then put it out there, and then people take the mick out of them. So what might be funny to your other autistic friend might not be funny to all your other friends. So they're putting themselves out to be vulnerable, to be bullied. Don't give personal information. Don't compare yourself to others online. Because I think for girls, one of the things is that they'll be looking at TikTok videos, what other girls look like, what other girls are like, what they're doing, and then feeling that maybe they're not as good or not as pretty or not as thin, and that's going to have an impact on their well-being. Okay, how am I doing for time? So going to talk a little bit about emotion regulation and stress. So girls with autism often have higher levels of stress and poorer self-regulation of emotions. We know they often have more social anxiety. So this is that they're aware that they're different, and they're aware that they might be getting it wrong, but then it almost becomes disordered, so like social anxiety. So they might always be having thoughts of, everybody thinks I'm ugly, everybody thinks I'm stupid, they're all judging me. And then they start doing those safety behaviors of like, I'm not going to look at anybody, I'm not going to talk to anybody, I'm not going to leave the house. So that's when it kind of goes from autism to social anxiety as well. They have challenges with other people, and they might not understand what other people mean. Things are rigid and inflexible. They struggle with the sensory overload of the environment. We also know they have poorer coping strategies. So lots of young people that self-harm are autistic. Lots of people with autism will just avoid or withdraw because it's easier and it suits them better, but then they become more depressed, more socially isolated, and need support to get back out to things. And I guess they're less able to talk about their feelings and needs, less able to communicate those effectively. So this is why stress and anxiety and emotion regulation is so much of a problem for children with, for young girls with autism. So won't go into all this because I'm sure you all know lots about autism, but this is just my stress bucket. So I like to think of it as a bucket that you fill up with all the things that cause you stress. And what we find is young people with autism's bucket is like verging on tipping over all the time because they've got to think about noise, struggling to concentrate, changing routine, not understanding the rules, lots of worries, difficulties of communication. So they've got a lot more to worry about than just a typical girl that would also have lots of things to worry about anyway, teenage girl. So we might then experience physical sensations of anxiety. So all those things are worrying, but all those things are contributing to worry, but if we then have, I'm not going to talk about that, but I'll talk about what happens to our body. If we have butterflies in our tummy, we're being sick, we're going to the toilet a lot, our heart's racing all the time, we're feeling sweaty, feeling faint, maybe on the verge of a panic attack a lot of the time in the day. If we're feeling like that, why would we want to put ourselves through that every day? It's much easier to stay at home and not have to face those feelings. And so that's what's happening in their body. So we want to engage them in some relaxation things. So I talk about breathing exercises. And I think these days, if you Google breathing exercises, you're going to find a nice little video. I didn't want to stick videos in here because when you're on Zoom, you have to like stop sharing, then share, and I just thought it would just be really difficult. But you can Google breathing exercises, or this is one I use all the time. You just think of drawing a square. So you breathe in, you breathe out, you breathe in, you breathe out. And so I've had people that basically are sitting there drawing a square, breathing, and that just simply that breathing exercises will reduce the tension in their body and make them feel a bit calmer. Something we might do in therapy, but actually there's no reason parents couldn't do this kind of exercise with young people at home. It's kind of challenging unhelpful thoughts. So if somebody's saying, oh, I feel really stressed, I can't do this, I can't do that, you might say things like, you know, what would a friend do in this situation? So if they're saying, I need to do this assignment, I need to do this, what would a friend say? Well, a friend might say, actually, you need to take a break. And so having that conversation with them, getting them to say, well, what would your friend say in this situation, allows you to then back up what you might be saying. No, you need to stop studying, you need to take a break. We might just, if they're saying I'm ugly, everybody thinks I'm stupid, I don't have any friends, you might just say to them, is this a feeling you've got, or is this a fact? What facts do we have about this? Do you really not have any friends? I can name 3 of your friends. Or do you know, who's called you ugly and stupid? Nobody. So it's not a fact, it's a feeling. So just having those conversations with them just might help them to kind of balance that thinking a little bit more. And I think the most important thing I talk about with thinking about stress in autism is changing the environment. So if you've got a noisy environment, that's really stressful for them. I had a girl in a session, I think it was yesterday, and she just couldn't cope with, there was a ticking clock and a whirring sound from one of the machines in the room. She just couldn't concentrate because of all these sounds, whereas I hadn't really even noticed them. And so that it takes up more brain capacity and it's more things for them to think about than perhaps neurotypical people have to think about. So try and get these things right. So is the room the right temperature? Have I got things to fiddle with if that's what I need? Have I got my ear defenders? Is how can you manage the environment to reduce some of that stress, I guess? And then what I sometimes use is just simple grounding exercises with people, and anybody can do this. So if you're feeling really, really stressed, it's just being able to go, right, I'm losing it here. I need to ground myself to where I am and what I'm doing at the moment. So I might look around the room and name 5 things I can see. I then think 4 things I can feel. So what can I see? I can see a clock, a yellow wall, my phone. what the clouds outside. I can feel the jumper on my skin, the floor under my feet, my hair. Got one of those hairs brushing across my face that I can't get out of the way. I might be thinking I can hear the clock. I can hear somebody walking down the corridor. I can smell disinfectant because I'm at work. And I can taste Marmite from a toast. There you go. So those kind of things just help you to ground into the room and help you to stop concentrating on all those thoughts that are whizzing around your head, making your panic worse. And I think I'm just going to finish on the other thing, which is understanding autism and strengths. So often we jump to this, this girl's got autism, she's got anxiety, she's got mental health problems, so she's self-harming, she's got anxiety, she's struggling to get to school, we need therapy to make her better, basically. And actually, a lot of what I end up doing in therapy is then helping the young person to understand themselves, because actually part of the problem is they don't understand why they're different, they don't understand what they're good at, they don't understand why they're struggling so much. And actually having that really solid understanding of what is autism and how it affects me is so important for mental health and well-being and self-esteem, because actually what they're struggling with is all they're noticing. So they're noticing I'm struggling with friends, they're noticing I don't like sounds and that makes me stressed, nobody else gets panic attacks because of that. But actually understanding all the positive things that autism brings to them is just really, really important. So we have famous people with autism that can be used as role models. So Greta Thunberg, although I think she was dragged off by the police this week, but usually I'm sitting here going, she was 16 and she spoke to governments around the world about her special interest in climate change, and she got that message heard, and that's amazing. People can't do that. David Attenborough's been talking about that for 50 years. And she made such an impact in a few months. We've got Olympic swimmers, we've got scientists, professors, there's so many super intelligent, creative, amazing girls with autism, and I don't always see girls that have recognized that or know that. So that's a really good starting point. And there's loads of strengths associated with girls with autism, so being really loyal and trustworthy, wanting to find out the truth, being logical, good attention to detail that other people might miss, intensely focused and passionate about an interest, someone who's determined and never gives up, good at spending time alone, perceive the world in a unique way. So that's just some of them. But I think it's so important that when we've got a young person that we think is struggling with mental health, for them to just understand themselves and understand that they can achieve and that they are going to do well is just really, really important. So that's the wrong conclusion. I'm going to conclude, that was from the last one I just used to start with. So I'm just going to conclude that, yes, girls struggle with, girls with autism do have lots of struggles with ASD. There is help out there. So for things like eating disorders, severe anxiety that's preventing them doing anything and no functioning, there's referrals to CAMS, but there's also services within schools these days. There's things like the mental health in schools team that can help support young people with a bit of anxiety, can help with self-esteem building. And I think there's lots of things parents can do and families just around supporting that young person to understand themselves, understand body changes, help them to navigate friendships, and help with their emotional well-being as well. There you go. Amazing.
Thank you, Laura. That was really good. Right, does anyone have any questions? We've got a little bit of time. If you do, you can either okay, Georgina, you've raised your hand. That's brilliant. Go for it, Georgina.
Hello, thank you.
Hi.
So I just wanted to say that just to sort of top up what you've just said, I read an article, and I'll find the link for it in a sec. So the Guardian did a thing where GCHQ, so I can't remember what it stands for, government's, it's something headquarters, it's all where the sneaky beaky stuff, they're actively recruiting females with autism, ADHD, dyslexia. So there's that change there that is happening. Definitely. But probably not quick enough for all our, that we'd like. But it's just nice to see articles like that. I can't remember, there was another employer, and I can't think who it is, because they're recognised for their positive. So disability is only a disability in the context you look at it. And it's sort of based on how inconvenient our children are in school, and that really bugs me. My son has a recent diagnosis, and it just feels like, and I feel like schools sometimes just think I'm being a pain as well. But I think it is important to recognise those positives as well.
I always look at it as children with autism may not fit into the box, the school box, the education, this is what you're going to be like. But if we all fitted into boxes, life would be really boring, and we wouldn't develop things, we wouldn't create things, we wouldn't, have all these amazing findings that come out. So, we rely on people with different brains to be able to innovate things and create and make the world more interesting.
Absolutely. Thank you. Right, I've got a couple of people to go to. So Louise has put in the chat, my daughter, we believe, is in burnout. How can we explain to people that she needs to take things at her own pace, and that she isn't just taking the mickey, basically? We are having to take pressures off and let her do what she can cope with, but this has made progress. But it's difficult explaining why this is so important.
And it is really difficult. We do hear about young people, girls with autism, that just cannot cope at all. And I think it's important to have to reduce the demands, but also to keep some in. So it's really hard. But like, for example, we see a lot of school refusal. And I think once you get those 3 or 4 weeks at home, it's so hard to get them back into school. And actually, if you can have a flexible school that says, okay, I can see you're struggling, come in just for an hour a day, and we'll see how that goes. And as we, because then you still keep that routine, you still keep that demand, but it's more manageable. And then to build it up very slowly with additional kind of, what do we call them, adjustments to support that young person. It's hard to explain, because I know a lot of families will come and say, oh, we're now being fined by the school because we can't get them to school. It's challenging.
It really is. It really is. And how do we tell other people, how do we justify it with, we always find family members can be quite judgmental, and other people that don't really get it. Is there an easier way to get people to understand?
I just think it's about educating them. I remember doing a session years ago where the grandparents turned up instead of the parents with the young person because of some family nightmare they were having. So he brought this young boy to the session, and I invited them in, and I said, what do you know about his condition? They went, not really. I mean, I know he's a challenge. and we had been doing work around what is autism and what are your strengths and things like that. And I just got the young person with me, supporting them, to tell their grandparents about what it was all about for them. And that made, the grandmother that cried at the end and said she hadn't realised what this all meant for them and what they were struggling with, and just had a completely different view. So I just think it's really important educating them. You say, oh, my child's got autism, everybody sort of goes, oh, okay. And then it's, oh, I can't come because my child's got autism. They think, oh, well, that's inconvenient. But do they understand why, or what's happening and why it's so difficult? So
no, absolutely. That's really, I think I'm definitely personally very guilty of that, of just being very generic and not ever giving any more than that. That's really helpful. Thank you. I've got somebody with the hand up. It says Simmons, but I'm sure that's not probably not your first name.
No, it's Sarah. Sorry.
That's all right. Go for it, Sarah.
So my daughter's 13, And we've really hit like a massive crisis point with her in like the last 6 months. Things have really deteriorated. So she doesn't acknowledge she's autistic. It's not a thing. We made it up. We wrote all the letters ourselves, apparently. She's stopped eating. She can't go out of the house. She's violent. She's not going to school. And at every service I try, I just kind of hit a brick wall, and we're kind of at a loss of what to do next.
Okay. Have you, when you say you've tried lots of services?
I've seen the paediatrician, I've seen speech and language, I've seen the dietitians. We can't get blood tests to see her nutrition because we physically have to carry her if we have to go to an appointment. We can't get weighed.
And how old is she?
She's 13 and a half. Her school are really unsupportive. She's got an EHCP, but her school are really unsupportive. Their idea of a phase return is she does 2 lessons one day and then she's back in full time, but she's not been going in at all really this year. And so CAMS have said, yep, she needs some really severe, high intensity CBT. And they've said that's, there's at least a 6-month waiting list.
Okay, so she's open to CAMS.
Only just, but they've said there's a 6 months waiting list.
Yeah, there is a waiting list.
I know. So we've looked at a private psychologist, but the CAMS said, yeah, we think she needs medication. The paediatrician said, yeah, she needs some medication, but nobody will.
There's a wait for that. Yeah, and it's really difficult because I was thinking as you were talking, I think CAMS would probably
3 referrals to get her in.
Sorry. But it's and I don't want to use this time to talk about services, but it's just we've completely stretched. It's really, really difficult.
I work at school as well, so I know what it's like trying to get. So
we're trying everything we can to get his recruitment's problem, trying to get more staff in. And I suppose when you're in that position and you know what you need, but you got to wait for it. There's not a lot you can do, or services can do particularly, but it's thinking. So you're saying she's getting in a bit to school? So this week she's done 4 hours spread across the week, but she's refused to engage. She just sits there and won't speak to anybody. That's today I can't get her in at all. She's just refusing point blank. She's also started her periods, but she won't accept it's a period. She says that she's got intestinal bleeding. She won't wear anything. So some of those kind of social stories around periods and trying to accept that is a normal process and that you don't need to be anxious about it. It's not very nice, but it's not something to be worried about. And then I think talking to the school, because I was going to suggest, could you get some sort of reduced timetable? It sounds like you're on that path already.
Yeah, we're trying
to think. So it just sounds really, really difficult.
Just in the meantime how to help her, because she won't be left alone for a second either.
Yeah, perhaps I'd probably suggest, because you've got our CAMS, if you're in our CAMS service, to ring the duty line and have a proper chat with somebody. This week's a little bit challenging, just so you know, because we've had the nurse strikes and we've got very behind, but maybe next week that's probably a good thing to do. Okay, thank you.
All right, great. I think that's everything, Laura. Thank you ever so much for your time. Thanks everyone else for joining us. It's been really useful, lots to think about. If you could send over the slides I've had, that would be great to be able to share them as well. I think we'll be going away and thinking about what I'm doing that on a personal level, what to do with my autistic girl. So thank you very much for that. That's been great. Thanks everyone.
See you again soon. Bye.